Welcome back. For more than 3 weeks now, health officials around the world have been sounding the alarm on counterfeit versions of the weight loss drug Ozempic. The FDA says it has seized thousands of counterfeit units of the drug, and to make it even worse, the FDA is warning that the needles packaged with the product are also counterfeit and may not be sterile. Joining me now is Dr. Sonal Harder with Dignity Health Medical Group. Sonal, when I read this is so disturbing and very troubling.
And it should be disturbing and troubling because number one, so what I found out was about 12 countries actually are dealing with this problem of fake Ozempic in their pharmacies, right? And back in October, around October and November, England and Austria actually had few patients that got hospitalized because of fake Ozempic.
Whoa.
And what we have found is in these samples, there's actually insulin. Now imagine insulin. Insulin is a medication that we use for diabetic patients,
right,
and it lowers your blood sugars. And if someone is not a diabetic, and if they don't need to be on insulin, they can have dangerously low blood sugar levels.
Wow.
And a couple of patients who landed up in the hospital actually had dangerous side effects from insulin, so seizures or even death. So that's one. We do not know what's packaged in these, in these medications.
Right, how do you tell? Yeah.
Correct. When it's not FDA approved, what that means is we don't know about safety, ingredients, dosage, or any other things that go with those medications. So it is, people need to know that this is a serious medication used for serious medical conditions, needs to come from a licensed healthcare provider and also from a licensed pharmacy.
Yeah, no kidding. Okay, so let's go into specifics here. We want to see, how can you tell between a fake and a real one?
And it's so actually hard. I looked at some of the samples and it's very close, so it can fool anybody. But FDA recently released the serial numbers of these fake prescriptions.
Okay.
So if anybody has any doubt about the prescriptions, if you got them online, if the deal was too good to be, true.
Oh yeah.
Get one free. I mean, these medications are expensive, Tram. Even with insurance coverage, it is several hundreds of dollars. So if you're getting a deal online, first of all, please do not get medications like these online.
Right.
Something that you're injecting in your body.
They have to be prescribed by your doctor.
Exactly. And the doctor has to know your medical history. The doctor has to sit down and talk to you about your medical history, side effects, benefits, risk, benefit ratio, all of that. If you are not getting that online, that is not the right way to prescribe these medications. So I say do not go online for these prescriptions.
Yeah, no kidding. Don't be your own doctor, right? Okay, so I also know that you had mentioned a couple of side effects. Yes. Okay, we have a list of side effects, but here's my concern when I saw these side effects and I was reading about, these fake drugs, is that some of these side effects, actually, you have them when you take the real drug. So how do you know,
so
the difference?
One, the question is, we don't know how much dose is in these medications.
Yeah.
So the side effects could be a lot more than a typical medication that is given by your doctor.
Okay.
Secondly, if these medications are coming from online, you actually do not have a doctor that's monitoring you or following up with you.
Right.
In fact, what I found was it is very easy to go online and go to one of these websites and get your Ozempic. They don't even check your weight or your medical history.
They just blindly give it to you.
Exactly. I also found some commercials on Etsy.
Whoa.
People are selling them on Craigslist. They're selling their own prescriptions. This is not how any medication should be taken. So I want people to know that I know that sometimes we want a medication that is going to help us, and insurance can be a big problem, but let's do it the right way.
Yeah.
Because all these things can have real serious complications.
Yeah, go to your own personal doctor.
Correct.
All right, Sonal, thank you so much. I know